Welcome back to our program. Joining me now is Dr. Ed Bernacki, Executive Director of Health, Safety, and Environment at Johns Hopkins University. In this segment, we're going to take a look at how Hopkins is continuously working to avoid accidental allergen exposures at their facilities. Johns Hopkins has a unique challenge in managing not only hospital settings, but also labs and classrooms. Even their grounds crews have unique risks. Welcome to the program, Dr. Bernacki, and nice to see you here back at ACOEM. Welcome.
Nice to be here.
Before we get into the specifics, could you just tell us a little bit about your roles at Hopkins?
Well, I'm a professor of medicine at Johns Hopkins, and I'm director of the Division of Occupational Medicine in the School of Medicine. That's my academic role. But I also am the chairman of the safety, it's called the Joint Committee on Health, Safety, and Environment for both the Johns Hopkins Hospital and University. And we have roughly 60,000 employees that we're responsible for in Maryland.
Speaking about those 60,000 employees and their health, how important is anaphylaxis preparedness?
Well, significantly important. I think we recognize it from the clinical setting prior to sensitization in the area of latex and patient safety. But in our environment, we have to worry about the grounds crew. We have to worry about the individuals who are sensitized amongst our employees to antigens that can cause anaphylaxis. And we have to worry about our patients. So our cornerstone is preventative programs. 12 years ago, we initiated a latex-free policy, and that's worked out very well. We rarely have a case of occupational asthma secondary to latex in our environment. We created policies to reduce the risk in the laboratory. We ban the eating in laboratories and other areas, desks, offices at Hopkins. And this has significantly reduced the risk down. And on the treatment side, all employees, when they come into Hopkins, in essence, fill out a questionnaire. Are they allergic and have they had an anaphylactic reaction? And if they have, our nurses counsel the employees about epinephrine auto-injectors, make sure that, or try to counsel them, hopefully they'll get them. We also counsel them on, if anything, to recognize the symptoms, but to present to the emergency room, present to occupational health if they have a significant problem. The other thing that we do is ask the employees to let their supervisors know that they have an issue like this so that the supervisor could help them out.
And it sounds like you've really taken a proactive approach to identifying at-risk employees. Are there other measures that you can tell us about that you've implemented that increase all-employee awareness?
Well, we have a poster campaign in our common areas of our hospitals that flush out really what an employee should do if a fellow employee is having an anaphylactic reaction. And this is primarily in the cafeteria areas. And that would be to stabilize the individual, make sure that you maintain an airway. If the individual has an epinephrine auto-injector, to inject that, and our state allows that to occur. And probably the easiest thing, of course, is to triage that individual off to the emergency department or occupational health so the employees know what to do in case of an emergency.
Just to be clear for our audience, state laws may vary on who can administer or assist in the administration of epinephrine auto-injectors, so be sure to check the law in your state. Ed, thinking about our audience and individuals maybe working in other organizations or companies and interested in getting a program started like the one that you've been instrumental in at Hopkins, are there some simple recommendations or direct ways to get started?
Well, I think that the organization has to realize that this is a significant problem, and that allergic individuals can actually die from this condition. So I think once you realize that, you can take measures. And again, the most important measures: identify the employees who are at risk, have a cadre of individuals who are trained in how to deal with this particular problem. If there's food served, query the employees that they have food allergies. I think those preventative measures at least can get you started.
Ed, you've obviously made some great strides at Hopkins. Thinking ahead and building in the concept of continuous quality improvement, what additional measures would you be looking at over the next few years, and how do you see those playing out?
I think I just want to build on what we're doing and probably get the message out even better amongst our employees about the importance of preventing anaphylaxis, about employees who have had a previous episode of anaphylaxis to have an epinephrine auto-injector. And I think that would probably improve our program more. Although, as I was saying, we have very, very few incidences of occupational asthma in our environment, and very few of our patients now have an anaphylactic reaction secondary to latex. So I think we've done pretty good.
Well, again, Ed, thank you for being here with us today. And again, welcome back to ACOEM. You know you're welcome anytime. I'm sure that many in our audience are going to find elements of your experience relevant in their own institutions and will help them move their own programs forward. So thank you again for being with us. And if you have any questions for Ron or Ed, be sure to email them to us at the address on this page, and we'll get back to you with an answer shortly. Coming up after a short break, our final guest from the program will talk about a worst-case scenario, an anaphylaxis reaction. Are you ready in an emergency? Don't miss it. We'll be right back.